Welcome. I'm Fola May, and I'm a gastroenterologist in Los Angeles. On behalf of our board of directors for the Association of Black Gastroenterologists and Hepatologists, I'm very excited to welcome you here this evening for our 2024 Association of Black Gastroenterologists and Hepatologists Colorectal Cancer Awareness Panel. This year, we have titled our panel, Real Talk, Why Are So Many Young Black People Getting Colorectal Cancer? I'd like to tell you a little bit about our organization. ABGH aims to promote health equity in Black communities, advance science, and develop the careers of Black gastroenterologists, hepatologists, and scientists. The visions of ABGH are to improve gastrointestinal health outcomes in Black communities, foster networking and sponsorship among Black students, trainees, gastroenterologists, and hepatologists, develop the pipeline for gastroenterologists and hepatologists who are Black, and promote the scholarship of Black gastroenterologists and hepatologists. Today, we will discuss a disease that unfortunately disproportionately affects Black Americans. Throughout the session, please add your questions to the Q&A box on your screen. At this time, I'd like to introduce our moderator, who is Dr. Rachel Asaka, and she will lead our panel in this discussion today. Dr. Asaka is a gastroenterologist and clinical researcher at Fred Hutch Cancer Center and the University of Washington. Her research focuses on improving uptake of colorectal cancer screening and decreasing the mortality associated with colorectal cancer, with a special focus on medically underserved populations. Rachel?
Good evening, everyone. It is my pleasure to be joined by this esteemed panel today, where we are going to really get into the details of why so many young Black people are getting colorectal cancer. Before we get started, I want to share a recent statistic, and this comes from the American Cancer Society. It says of all cancer deaths in people under 50, colorectal is now the number one cause of cancer deaths in men and the number two cause of cancer deaths in women. And by the year 2030, it is estimated that colorectal cancer will be the number one cause of cancer deaths in people under 50 years old, period. So this is why this conversation is important. And I'm really thrilled to introduce this esteemed panel that will be engaging with us on this topic tonight. Dr. Earl Campbell completed his fellowship in gastroenterology and hepatology at Yale University School of Medicine. During his fellowship, he was selected to serve as a chief fellow. After completing his fellowship, he went on to complete additional training in advanced interventional endoscopy, and he is now in practice in Atlanta, Georgia. Next, we have Kimberly Holliday Coleman, who, after receiving a shocking stage 2 colorectal cancer diagnosis, her husband and her children realized that life as they knew it would change, but they had no idea how immeasurable that change would be. Kimberly has since then become an inspirational speaker with a focus on colorectal cancer and ostomy awareness, and this work led her to becoming a Fight Colorectal Cancer Ambassador, a model in Melbourne Fashion Week, international burlesque performer, and Community Advocacy Award recipient. Next, we are joined by Jeremy Eccles, who at the age of 33 years old started to experience some consistent abdominal pain, which he didn't initially think too much of. But after about a month of that pain not going away, he underwent that diagnostic workup and was found to have stage 4 colorectal cancer. His treatment experience has involved many ups and downs, and has included him going along this journey with relatives who've been diagnosed with cancer as well. So I look forward to learning more about that. And finally, we have Bashir Sylvain, who is a Haitian-American actor, writer, director, and producer, known for several roles, including ABC's Blackish. Bashir's personal life has also been deeply impacted by colorectal cancer. The tragic loss of his wife, Shannon Sylvain, to colorectal cancer in October 2018 has really galvanized him into becoming an advocate for cancer awareness, colorectal cancer awareness, and also addressing the disproportionately high rates of this disease amongst Black Americans. So thank you, everyone. Before we begin this conversation, we're going to ask our audience to participate with us in a brief quiz. First, we want to know, where are you joining us from tonight? Go ahead and type your answer into that poll. The second question, we want to know, at what age should average risk Black or African American people begin screening for colorectal cancer? Is it age 40, 45, 50, or 55? And certainly if you don't know the answer now, we hope you will by the end of this discussion. The third question, which of the following groups is considered the highest risk for colorectal cancer? Is it individuals who self-identify as white or Caucasian? Is it Black or African American people, Latinos, or do all these groups have equal risk of colorectal cancer? And finally, which of the following tests are acceptable for average risk colorectal cancer screening? Is it the stool-based tests like the FitKit or Cologuard? Is it colonoscopy? Is it the CT scan, which is a virtual colonoscopy? Or is it all of the above? Well, I'm thrilled to begin this conversation, and I'd like to start with Jeremy. Jeremy, tell us about what your life was like before you were diagnosed with colorectal cancer and when you suspected that something might be off with your health.
All right, thank you. So I got diagnosed when I was 33 years old. At that point in time, I was approaching about the 10-year mark in my career, and the job was going very well. My wife and I had started the process of purchasing a new home, so we were really excited about that. And up until that point, I hadn't really had any serious health-related issues that I had to deal with. I consider myself a pretty healthy person. I was never a smoker. I tried to eat right as much as I could. I don't drink a lot, and I work out a lot. I have a pretty strict fitness routine. And so needless to say, I wasn't really, I was very shocked when I ended up getting the diagnosis. I went out for a run one day, and I started to notice that I had a pretty sharp pain in my abdomen on my left side. I had never felt anything like that before, but what I had just told myself was, oh, you probably pulled a muscle, you probably hurt yourself in the gym. I wouldn't worry about it too much, but I was still kind of mindful of it. And that lasted for about 2 weeks. I just assumed that it would go away, and it didn't. So it was consistent for about 2 weeks, and I still didn't do anything, but I then started noticing that I had some blood in my stool. And that's when I was like, okay, that's not right. So I immediately called a colorectal surgeon to see if I could schedule an appointment. I asked for the first available. I actually met with someone that I didn't know before, had no prior relationship with. And I'm really grateful for him because when we met, I kind of went over my background, told him some of the things I was experiencing, talked about my lifestyle a little bit. And what he said was, okay, well, I don't think it's anything serious, but what I want to do is I'm going to schedule a colonoscopy just to rule out something serious first, and then we can backtrack from there and figure out what's going on. And thankfully, that was the recommendation from him. During the colonoscopy that I had a couple weeks later, he found a mass. He had to do a biopsy, and turns out that I did have colon cancer, and I was diagnosed at stage 4. So for me, going back, my first symptom was the abdominal pain, but the first time I thought that maybe something going on with my health was when I started noticing the blood in my stool.
Thank you for sharing that. we're going to come back to so many of the things that you touched on because they're so important for folks who are listening in today. Dr. Campbell, I want to turn to you next. What is the colon? What exactly is colon or colorectal cancer? We hear these terms interchangeably. Are they the same? Are they different? And is it common for colon cancer or colorectal cancer to run in families?
The colon is a long tube-like organ. Some may refer to it as a large bowel. It's responsible for a lot of the water or fluid reabsorption and the formation of stool after the stool contents are passed from the small intestines into the large bowel. Colorectal cancer is basically due to an error in the replication or natural process of the repairing and relining of the colon wall that then leads to the formation of a little bump or nodule, which we call a polyp, which they could turn into a larger polyp or mass, which is colorectal cancer. And yes, colorectal cancer can definitely run in families, and that's why it's very important, and we urge everyone to make sure that they know their family history, and if they don't, to make sure that you ask your family members about colorectal cancer.
Thank you for sharing that. One of the questions we ask the audience is, who does colorectal cancer impact more? So can you tell us a little bit about who it impacts? Does it impact men, women, people of race, different racial backgrounds, the same or differently?
Yeah, so colorectal cancer is one of the most common cancers. And I know we mentioned it earlier, it's the second most common and third in cancer deaths. It impacts men and women, but unfortunately, Black and Native Americans have the highest rates and deaths after diagnosis.
Thank you for educating us on that. Kimberly, thank you for joining us. Welcome. And I'd like to turn the conversation to you next. So can you share a little bit with us about what your life was like before you were diagnosed with colorectal cancer? What symptoms did you have that prompted you to seek medical care?
Hi, thank you. Well, I was diagnosed in the summer of 2015 in July, and preceding that time when I actually had my colonoscopy, it was about 7 months of symptoms. And so it started basically in January of 2015 when I started noticing that I wasn't feeling quite myself. Much like Jeremy, I had a very unremarkable health history. Nothing had really gone on for me medically. And so at the age of 47 to now be experiencing these different symptoms like bloating, dizziness, not loss of appetite, again, feeling off. And then I started noticing blood in my stool. And I thought it was hemorrhoids because I've had children, and that's generally what doctors say. And so I went from January to March. I was able to get in with my OBGYN, and she checked me, and, she was just like, I think it's hemorrhoids. And I said, well, I just don't feel myself. And so she sent me home with a take-home test, and it came back negative and for colorectal cancer. So that was in March of 2015. And so she's like, hey, if you're not feeling well, come back, I'll get you in for a colonoscopy. So 3 more months go by, my symptoms are increasing, things are I'm just not feeling well at all. I'm barely eating, I'm barely voiding any type of stools, and they're coming out very narrow and thin. The blood in my stool is increasing. And so by the time I called her back and I was like, hey, this is getting worse, they were able to get me in July. And I went in and had the colonoscopy consult. And I showed her a picture because she asked me, how much blood do you think you're losing? And I, not able to quantify that when it's in a water substance, kind of diluted. So I took a picture, and her face when she saw, because it was equivalent to like a menstrual cycle by then. And so I got in clearly for the colonoscopy the next week. And upon waking up, the doctor who did the colonoscopy told my husband and I, that he found a fist-sized tumor in my sigmoid colon, and he was pretty sure that it's cancer. So that led me on my journey at the age of 47 with a stage 2 colorectal cancer diagnosis.
Wow. Thank you for sharing that with us, Kimberly. I'm hearing so many common themes between your journey and Jeremy's, but I want to turn to Bashir for a minute. Bashir, welcome, and thank you for joining us. Tell us about you and your wife's journey with colorectal cancer. Are there connections between what you're hearing Jeremy share and Kimberly share and what you experienced with this disease as well?
Yes, first of all, thank you for having me. There's definitely some connections and also some surprises as well, too. She was diagnosed a week before her 34th birthday. We were married a year, and she had no symptoms whatsoever. Very healthy. She had a flu, or just a regular checkup with her doctor. And one thing doctor was like, is there anything else that's going on? And she was like, well, there's a faint blood in my stool, but everything else is fine. You were like, it could be anything. And truly it was faint. So they didn't really pay attention to it. They were like, it's perfectly fine. Here's some, medicine, just in case, if it gets worse, let us know. And so she went on and on and on and on. Everything was fine. Months later, she went back to the doctor and to basically check up again. And they asked her again. She was like, well, there's a little faint blood in my stool. That's it. But everything else is fine. And I'm a little fatigued. But she was working a lot. So to her, it was just like, all right, I'm just working a lot and I'm just a little tired, but everything else seems fine. Then the doctor, lucky enough for us, the doctor suggested that, all right, well, since it's not that much of a problem, we could do a colonoscopy, but let's just do one just in case, just to be sure. She went in and they found a foot long polyps that were just all over her colon, and she was diagnosed stage 4 right away, and they gave her 6 months to live. We both literally laughed at it because if once you see her picture, you will understand. We were like, there's nothing wrong, which is another thing that I can't wait to talk about, this perception that we have when we're sick, we have cancer. So they did an operation. It took a foot out of her colon. She went to remission for a year. We cut out our diet. We went raw vegan. We didn't even know what a colonoscopy was. We didn't know what a colorectal cancer was. And so much information was coming in. But for a year, we did everything that we could. She went through chemo and got better. And then it came back because she had 14 lymph nodes that were affected, so it spread into her liver. And once it got to her liver, it grew and grew and grew, and we lost her in 2018, which was very unfortunate. But what was great is that throughout that whole process, her entire mission was to make sure to educate African-American people about this disease, because we both didn't know. We had no clue what that was. And also she found out later on that it did run in her family history, and no one said anything. So it was so important for us to really tell people about this. And for her last year, she started a company called Brown Sugar Rehab to basically educate folks and also try to help create funding for people that can afford it, because colonoscopies are not free, especially if you're not of age. They don't administrate a colonoscopy unless you're in this stage that she was. So luckily enough, it was found, and so she was determined to let people know. So that's why I'm super excited to be here and be able to talk to anybody that's out there to educate them and not have them have the experience that I've had.
Thank you, Bashir. Sorry for our loss because of just how incredible of a person she sounds based on what you described and the legacy she's left behind. You brought up an important point, which is the family history part. So about 25% of colon cancers are inherited through families. And that's why it's so important to talk about family histories, to talk about, how did uncle, auntie, cousin, nephew, niece, what did they die from? And unfortunately, that is a conversation that doesn't always happen in Black communities. So thank you for sharing that. Dr. Campbell, you heard about a myriad of symptoms that Jeremy, Kimberly, and Bashir shared. What are the most common symptoms of colorectal cancer, and what should people be on the lookout for?
Right. That's a very good question. Unfortunately, most of the time, people don't have any symptoms. And that's why it's important that, and we'll get more into that, we focus on screening everyone. When symptoms do occur, they can be in the form of blood in the stool, dark black stool, persistent abdominal pain, diarrhea. Someone had mentioned even thin or like pencil-like stools. And then from a lab work standpoint, it can be presented in the form of low iron levels, anemia, and also just fatigue, extreme tiredness, and weight loss.
Thank you for sharing that, Dr. Campbell. And if you're just joining us, welcome. This is the 4th annual ABGH Colorectal Cancer Awareness Month event. And we are here with Jeremy Eccles, Kimberly Coleman, Bashir Sylvain, and Dr. Earl Campbell. So Kimberly, Jeremy, then Bashir. Remind us of how old either you were or your relative was when they were diagnosed or started having those symptoms.
I was 46 when I started noticing the symptoms, and 47 by the time I had the colonoscopy and was diagnosed.
I was 33. This was in 2018. 33 when I noticed the symptoms, and 33 when I got diagnosed.
Shannon was 33, a week before her 34th birthday.
33, 47. Dr. Campbell, so is this a common phenomenon?
Unfortunately, over the last 3 decades, studies have shown that colorectal cancer has increased by 50% in people under the age of 50. And this is what we call early onset colorectal cancer. And this has actually led to a decrease in the age for initiation of colorectal cancer screening, which used to be 50 across the board, that has now been lowered to the age of 45 back in 2021. Because people born in and after the 1960s are at higher risk for colorectal cancer compared to older generations, which suggests there might be some things, for example, in our environment, foods, medications, now that the older generations were not exposed to. These are reasons that are still being studied.
Jeremy, I want to switch gears a bit here. Once you received the diagnosis of colorectal cancer and then you began treatment, tell us about that journey for you, and if there were interactions you had with members of the healthcare, your team, that still stand out to you today.
Yeah, sure. So I want to go back a little bit, back to where I was when I had my colonoscopy. The surgeon told me, like, hey, we see you have a tumor, but I can tell that it's really young. So we caught it early. And the first thing that I had post that procedure was a colectomy. So they scheduled me for the surgery, which was to remove the tumor from my colon. They were convinced that I was going to be stage 1. It was localized. We'll do the surgery. And he said, you may do about 3 or 4 rounds of preventative chemotherapy if needed, but you may not even need it. So I had the surgery, went through the recovery, and after the recovery, I ended up getting an MRI and a PET scan. And when I had the PET scan, my body lit up like a Christmas tree. The cancer had spread to my liver, it had spread to my aorta, and I could see the look on my oncologist's face. He was really confused, like, well, we probably should have caught this before you even had surgery. So I had to go through, I guess, a full-blown 15 rounds of chemotherapy. I was on a combination of 3 different drugs. I had 2 that I would take once every 3 weeks through an IV, and I had an oral drug that I would take every day for 2 weeks at a time. So the journey through treatment was definitely a journey. It was a challenge both physically and mentally as well. I had a lot of different side effects. I felt like I was constantly in and out of the hospital, either going to get treated or going to appointments or just meeting up with other professionals there to kind of track how my treatment plan was going. The side effects were pretty significant. I had a neuropathy pretty bad in my hands and my feet, to the point where if I wanted to pick up a pen and just sign my name, I couldn't do it. It just hurt that bad. I had to make sure that I was wearing comfortable shoes. I couldn't walk around barefoot, couldn't wear any hard bottom shoes because the neuropathy pain was just that significant. I had really sensitive to cold was another one that I had pretty significantly. I was, no matter what time of year it was, I was wearing a hoodie. I was wrapped up in a blanket because you couldn't get warm. Like you're always, I was always cold. I couldn't drink anything cold, couldn't eat any ice cream or anything like that. And of course, nausea, vomiting. I had a lot of fatigue, and I ended up losing about 30 to 40 pounds just in the first 2 or 3 weeks after I started treatment. So it was pretty debilitating on my body. And I think the other part of the question was about interactions that stood out with my health team. There were two. One I can laugh at now. It wasn't really funny at the time, but then I'll mention it real quickly. So on my first treatment, I remember I went there, and I'm completely brand new. I don't know how the process works. I wasn't aware of that. And I remember the nurse walks in, and she has the IV chemo in her hands, and she's wearing like the equivalent of a hazmat suit. And all I could think was, if the drug is so serious, you don't want to get a drop of it on your skin. You're about to put that inside of me. So they definitely had to like bring me at ease at that point. But that was a one that stuck out. But I guess the main thing, I guess like Dr. Campbell was saying earlier, the reason for the increase in young patients is still being studied. So I'll go back right before I got my official diagnosis, when I went and got the CT scan. While I was being prepped, there was a nurse that was getting the IV ready for my arm. She looked at my chart, and I could see her disposition just drop. And she looked at me and she said, "You're too young to have this." And at the time, I hadn't been diagnosed. So I told her, I said, "Well, I was told to come get a CT scan. I don't even know what I have. Can you tell me what's on the chart?" And she was like, oh, I'm so sorry. I can't relay that information to you, but you're going to have to talk to your doctor. And that was an aha moment for me. So, of course, that was really unsettling, like having that back and forth. But it also does highlight the fact that younger patients being diagnosed with colon cancer is still fairly new, even to medical professionals. That she looked at my chart and was like, wow, how is this even possible? So I would say those are the two most memorable interactions that I had throughout my treatment.
Wow. Thank you. Thank you, Jeremy, for sharing that. And I can only imagine in those moments how that must have felt. I want to turn to you, Bashir, and the experiences that you and Shannon had while she was going through the diagnosis and getting treatment. Are there any memorable interactions that you had with members of your healthcare team, either positive or less than desirable?
I mean, it pretty much what Jeremy's talking about was very alarming because they didn't know what to do because she was so young. So they were like, all right, we'll do radiation. So not only that she had to go through radiation, but, we were married only a year. And so we were thinking about having a baby. So where they had to radiation, they decided to have to peck her ovaries to the side. So she had to do another surgery to basically move her ovaries to the side so the radiation doesn't hit her. So after the radiation, they gave her a round of chemo. She had an allergic reaction to that. So they had to give her another type of chemo, the pill one. She had a reaction to that. So they had to go to another chemo. We went through at least 3 different types of chemo with her. And then we found out one of the ovaries dropped. Luckily enough, it wasn't affected. So what we had to do is just basically take some eggs out, and just in case, just to be safe, to make sure that we have that. So it was not the most pleasant thing in the world at all. The moments that were pleasant is the fact that the first year after she went to remission, and she survived 3 more years after that. When we decided to not focus so much of her being just a patient and just focusing on our marriage and focusing on just choosing life instead of making this thing become bigger than what it was. We both, our faith are we're both believers. We believe in God, and so it was a miracle, truly. I could say this now, that we were very blessed that our interaction with each other and with family and with friends really helped us push that first year, that allowed her to do 3 more years with us. Because at first it literally was like 6 months and she's gone. And we refused that, to believe in that. So there's something about the strong will of wanting to see a positive effect of it. And also I strongly feel like when we decided to change our diet, when we talked to a nutrition about that, that was a really great positive thing for us, for me as well. I decided whatever she was doing, I would do it as well. That really helped a lot. I even tasted the prep for the colonoscopy. Oh my gosh, I was just, I just wanted her to feel comfortable. And I know this is a great flavor. It doesn't taste like great. It's just horrible. But but yeah, no, we were very blessed to have some of the best doctors. Once I find out that it was going to be over, I was just, it was not pleasant. But during the time, like I said, the family, friends, and Dr. Zeb, him being honest was very helpful, because I really didn't want us to think differently or put ourselves in a situation that didn't allow me to have the situation I have right now. I'm very glad that we were able to go through what we went through the way that we have, because we chose to be positive about it instead of just being negative.
Thank you for sharing that. The challenges as well as the moments of levity, and being able to laugh and live through a very difficult period in your life. Dr. Campbell, so you've heard our panelists share their experiences with colorectal cancer, screening tests, interactions with healthcare providers, treatment, healthcare systems. I have 2 questions that I want you to talk to our audience about. First, what is a screening test? What are the options for colon cancer screening? Then number 2, I want you to touch briefly on how physicians and other healthcare providers can really best support patients and their families throughout their care.
So you want a test that's able to capture as many individuals that have colorectal cancer. So if out of 100 people, 20 of them have colorectal cancer, you want the test to be able to capture all 20 of those individuals. And even if it needs to maybe capture 25, with 5 of those having a wrong result at first, you'd rather err on the side of catching everyone and then telling them later, okay, don't worry, it was nothing, rather than a test that misses some individuals that may have cancer. So that's what a screening test is. You want a test that is as sensitive as possible. There are different screening modalities. The most common one that we all know about here is a colonoscopy, right? So colonoscopy is probably one of the most intimate photography sessions that you'll ever have. It's a flexible fiber optic scope that you place through the rectum and go all the way to the first portion of the colon, and you take pictures of the colon on the way out. You're basically looking to see if you see any masses or if you see any precancerous lesions that you can remove at the time, right? Other screening tests include stool-based tests. Some of us had mentioned some of the fecal occult blood tests or FIT tests that look for blood in the stool. everyone's heard about, or not everyone's, a lot of people have heard about Cologuard. The commercials on TV all the time these days that looks for abnormal DNA in the stool as well. And they have CT colonography. There's CT scans specifically used to look for masses or polyps in the colon, right? So there are 2-step and there are 1-step tests. The colonoscopy is a 1-step test, meaning that not only are you looking for masses or polyps, but you're also able to remove them at the time of the procedure and get a diagnosis. All the other tests, if they come back negative, you're done. But if it comes back positive, you then have to get a colonoscopy, right? And regarding the second question about how we as physicians can help support our patients through the process, patients as well as their family members, I think Bashir had mentioned a very good point. It's honesty, transparency, letting your patient know exactly what you think is going on, right? So that they can prepare and be ready for what lies ahead. And I think also Jeremy had made a good point in that there was something that was relayed to him by another member of the healthcare team accidentally in the process that was not already relayed to him by his physician. So it's very important that not only are you transparent, but try to do our best to be prompt in giving patients their results as soon as we can, and also just to be available to answer any questions. And sometimes all it takes is just taking a little bit of additional time to just sit down and ask your patients, hey, is there anything else I can do for you? Do you have any other questions? And making sure that they really understand what's going on.
Thank you, Dr. Campbell.
I also had, don't be afraid to ask questions. I think a lot of us get scared. You know, you're in a position that you're so terrified. We came in with notebooks. Like, we came in like, all right, let's if we're gonna beat this, let's go. Like, please, because it's no joke. As afraid as it might feel when you first hear the situation, know that as much information as you could give your doctor, the same way that it could give you more information. And the more you know, the more questions that you have, and there's no dumb questions. Ask whatever questions that you can so you could feel comfortable at least knowing what's going on, because that's what helped us. I think it helped us a lot because we really was like, look, we don't know what this is. You need to explain to us like we're 5-year-olds, you know. And that helped us. I think that really helped us be able to fight as long as we did.
That's great advice. Go ahead, Kimberly.
I love all of that. And also just writing things down, like what you're saying. I keep like a book whenever I go to the doctor, and I've written things down because a lot of times we'll get there, we're already not feeling well, we forget things, or you know, it's just all of this information because like what Bashir was saying at the beginning, you're overwhelmed. You have so many doctors, so many you're thrust into this whole medical ecological system that you've not been a part of. And so I noticed that taking notes and keeping charts and this is what I'm feeling and taking pictures. You know, I know a lot of doctors don't want to see it. However, that actually helped me to get my colonoscopy because when they sent me for the colonoscopy, it was for a consult. And I could tell they really weren't taking it very seriously. But when I pulled out that picture and I pulled out my notes, the whole energy changed. So that can be the difference between staging. You know, like if I hadn't brought the picture, maybe they would have denied it and I would have gone on and you know, who knows what would have happened. So as much as we can be proactive, taking notes, bringing people with us that will actually help be a part of a great conversation or a proactive conversation is important as well. And if they tell you no, keep going, keep fighting for what you know, because that actually helped me to continue being persistent about something's not right. And a lot of us, you know, if a doctor tells us no, we're like, okay, you know, instead of being like, I know my body, I've lived in this body for, at that time, 47 years. So I know when something's off. So trust yourself and keep advocating for yourself.
That's great advice. Thank you, Kimberly.
Yeah, just 2 really quick things. Kimberly, I love what you said about, especially about the picture. I actually did the same thing. It was uncomfortable, but it was also evidence that you can present to your care team as well. So, and from my doctor's perspective, he was happy to see it. He was just like, yeah, sure. Let me see what's going on. So I know that also helped me to get the colonoscopy. But I also wanted to highlight something that Dr. Campbell said that about the communication channel between patients and their medical team. So, and I'll share my experience. I got my official diagnosis through a voicemail. I had missed the call, and I missed a call from my doctors from the hospital, and it said, "Hey, I'm such and such from an oncologist who I had never met. I'm from the oncologist's office, and I'm calling to schedule a new patient appointment for you." So I know how to put two and two together. If you're scheduling for a new patient appointment, I am a cancer patient. But that's how that information was officially relayed to me. And so, yeah, that's definitely something that from a physician standpoint, just be mindful of how that information can be presented to the patient.
Just one other thing that kind of just been in my mind since Kimberly had mentioned it, that was a bit concerning, that stuck with me. I don't know, Dr. Osaka, your thoughts are on this as well, but it's very interesting to me. She mentioned that her presenting symptom was blood in the stool, if I remember correctly, right? And that she was sent at that point for a stool test, which I think is more useful in individuals that may be asymptomatic and they're just getting screening. But if someone that's already presenting with a symptom like that, like blood, I'm letting this know to everyone. If you have that, you should urge your doctor to schedule you or to see a GI doctor or for you to get the colonoscopy. Because those stool tests, if it's negative, then the question is, well, why do I have the blood in the stool? So that still needs to be evaluated. You can't just, oh, the test is negative. All right, we're done. So that was something that kind of really stood out to me.
Thank you for highlighting that. And we cannot emphasize enough, if you are having symptoms like our panelists are sharing, blood in the stool, abdominal pain that is not getting better, weight loss, pencil thin stools, these are potential symptoms of colorectal cancer and must be evaluated as looking for what's causing that symptom. That includes a colonoscopy. Same goes for those who have a family history of colon cancer. Those people need to get a colonoscopy. That's really the best test for them. For everybody else who is not having symptoms, who hits 45 and is due for screening, not having a family history or symptoms, for those people, we say the best test is the one that gets done and done well. But I absolutely agree with you, Dr. Campbell. For somebody like Kimberly who is having blood in her stool, the stool test is not the test for figuring out what's going on. Dr. Campbell, we talk a lot about the importance of screening in colorectal cancer prevention, but are there other things that people can do to lower their risk?
Yeah, that's a great question. Some of those things include increasing plant-based foods in the diet, increasing fiber, decreasing red meat consumption and sugar intake. Another thing is decreasing or even preferably quitting smoking and reducing alcohol intake. And also at least maybe 3 times a week, trying to get the heart rate up with some form of exercise.
Excellent. Before I close out, I want to give each of our panelists the opportunity to share one piece of advice. If there was one suggestion or one recommendation you could give folks who are tuned in today, it can be about your diagnosis, your treatment, your journey, your advocacy since your diagnosis. What would that thing be?
I would say the one thing is just to make sure that you do have the conversation. We're at a time now where we can't be passive about this or embarrassed about this. This is a serious, we've lost so many people, including celebrities like Chiwetel and all those, other celebrities and just people in your family. I mean, I lost my wife to this. So don't be afraid to have the poop conversation and there's nothing embarrassing about it. One of the things that Dr. Campbell talked about as well too, sugar consumption. That was one of the things that my wife we both figured out that we needed to tell people. Her company was Brown Sugar Rehab. That was her way of basically saying, handhead sugar is not the most healthiest thing in the world when it comes to cancer, because it feeds the cancer. So don't be afraid to ask talk to your family about it. And also, because of all this experience as well, don't be afraid to look down and look at your stool. You know, it got me very aware, because I didn't realize how much we don't even pay attention to that, due to the fact that she didn't have any symptoms at all. It was faint blood in her stool, and she luckily, saw it. And I started thinking, I was like, I don't even think I look. So whatever embarrassing moments, if you're like, oh my God, is this poo? But it's so serious, y'all. It's not even funny. It's not even funny. It's take away all the notions of, oh, colonoscopy, they're gonna put a tube. All that makes no sense, because you do not want to be in my position. You do not. Not as a husband or a wife or a father or daughter or mother. You do not want to be in the end of the situation. So whatever thing that you have, misconceptions or fear, know that that moment of embarrassment is minimal of the life that you could change. That's what I would say.
Thank you, Bashir. Kimberly, what's the one piece of advice you leave to our audience?
To build community. The day that I was diagnosed, I put it on my Facebook, not for likes or comments, but to be transparent, because I felt like that transparency would be a major part of my healing process. And through that, I started basically journaling online and just telling people about this journey I was on. And through that process, I was able to create this incredible community around me, this community of my husband, our children's school. It's just so many people, our family and friends, and just so many people were able to come in and walk with us through this journey that, you don't know whether you're going to make it. And that's not, to me, it's more about how we get through this journey, like your wife, like you, Jeremy. It's important, because even the day I was diagnosed, I remember on the way home, my husband and I were crying and in the car, and I said to him, because I'd had this internal conversation, that I'm going to be on the other side of this. I'm going to see myself on the other side of this. And I said, hey, let's stop and get some champagne and let's toast to being on the other side of this. So in building community, having like a forward vision, just seeing yourself moving forward. And while we cannot control what the body does, because I'm the fourth person I've come to find out in my family that's had it, and the only one to survive. And I had a cousin pass after me. She just passed a couple years ago. And no one was having the hard conversation. I didn't even know. I'm out here advocating. I'm talking about poop. I'm posting. And I did not find out that I was the third of four people to have this until she passed. So have those conversations within your community. Build that community. Lean on them. Cry with them. Pray with them, dream with them, all the things. Because community, I'm so grateful, that is what helped to carry me, much like, what everyone else here is sharing. So I truly believe that building community and having a vision of where you want to go with this and how you want to go through this process is so important and so vital to the patient. A lot of times we get diagnosed and you're just caught in the windstorm. You're just caught in the storm. You're in the hurricane of it. And you're in the eye of the storm. You cannot see anything because you're in fight or flight. So to bring yourself, you're going to be in fight or flight. I'm just going to let you know. But that's why community is important, because they have an outer vision. So I just always go back to that community, vision, faith, whatever it is you need to keep walking that journey, to get the answers you need, to get the treatment you need, to get the help you need, to get the love you need and the support you need.
Thank you, Kimberly. Jeremy?
I would say be your best advocate. No one knows your body like you do. No one is going to advocate for you like you will. So even if you haven't been officially diagnosed yet, if you're going through symptoms, don't ignore them. Go and express what you're experiencing to your medical professional, whether it be your PCP or if you have someone like a colorectal surgeon or anything like that. And don't just be so quick to accept what you hear. If something doesn't sound right, push back, ask questions, go get second, third, fourth opinions if that's what you need to do. Because in my experience or during my scenario, I met an oncologist who was a complete stranger. If he told me something that just sounded weird, that doesn't mean I have to just accept what he says. So definitely, that'd be my main thing. Advocate for yourself. Pay attention to your body. If you haven't been diagnosed and you have experienced some symptoms, please don't just ignore them and think they're going to go away. Early detection is critical. In my case, from first symptom to diagnosis was about 2 months, 2.5 months. Kimberly's case, it was, I think she said about 7 months. It's important that you figure out what's going on as early as possible to help the treatment plan work as best as it will.
Thank you, Jeremy. There you have it, folks. Colorectal cancer is common and it is increasing in people under 50 years old. And it can be devastating, but there are also opportunities to build and support our communities. We can reduce our risk with screening at age 45 or earlier if you have a family history. If you're having symptoms, do not ignore those symptoms. We can also change our lifestyles, including changing our diet and other habits, as you've heard about tonight. These things empower us, our families, our communities with knowledge and ultimately better health. I'm so grateful for the panelists for joining us tonight. Thank you, Jeremy, Kimberly, Bashir, and Dr. Campbell for an informative and engaging conversation. With the few minutes we have left, now let's go to the questions from the poll you all participated in earlier. Question number 2. At what age should average risk Black or African American people begin screening for colorectal cancer? I hope you heard this loud and clear. 45, 45, 45. This is the age that average risk people without symptoms or family history should begin colorectal cancer screening. And this is for everyone.
Question number 3 was, which of the following groups is considered the highest risk for colorectal cancer? And the answer is B, Black or African American individuals. And the reason for that is because not only Black and African Americans, but also Native Americans have the highest risk for development of colorectal cancer.
Which of the following tests are acceptable for average risk colorectal cancer screening? The answer to this question is D, all of the above. Thank you to our event sponsors, Exact Sciences and Freenome, and thank you to our national corporate members, including AbbVie, Johnson & Johnson Innovative Medicine, Pfizer, and Takeda. For more information on ABGH, a recording of tonight's webinar, and information on upcoming events, visit us at blackingastro.org. So this is the portion of our program where we want to bring in the audience into the conversation. Please place your questions in the Q&A box, and Dr. Campbell and I will answer as many questions as possible in just a moment.